Hi, everyone. This is Karen Bieber. I'm the CEO of the Georgia Center for Nonprofits, and we're happy to share the results from a statewide survey on the impact of COVID-19 on nonprofit organizations throughout the state of Georgia. And throughout this presentation, we'll be talking about results that span the size gamut of nonprofits. And I will be pulling out specific variances for organizations that are 250,000 or under at various times, but for the most part, the percentages were so close that we chose not to do too many specific slides by size. So with that, I want to get started. So we looked at revenue impact, overall financial stability, service delivery and client impact, workforce impact, and then we also wanted to think about pinpoint how organizations were feeling, or in other words, how they were forecasting and their confidence levels in moving forward throughout the year. And we'll be doing additional surveys that will provide kind of a trend line as we move through this crisis trajectory. So let's look at revenue experience. We looked at earned revenue, philanthropic, individual revenue, as well as government revenue. And so the red boxes indicate declines of actual experience, and then the green boxes obviously increases. And so when we look at each of these areas, earned revenue, for example, 44% of all respondents in this study, which there were 520, report 20% or more impact. In other words, 20% of their total earned revenue was impacted, which is a fairly significant amount if you think about losing 20% of your revenue in any one category. But you'll note that roughly 25% of respondents or in the study report that 50% or more of their earned revenue was impacted. That's a massive impact. In terms of philanthropic revenue, again, 45% report a 20% decline, and again, 21%, 50% or more. And then individuals a little less, but we do have 40% reporting significant reductions. In terms of government, we know that the state budget cuts have just happened. Today is June 24th, and so they've just been announced, and therefore those effects are not necessarily taking place yet or reflected in this study. However, we do expect this to increase over time. I will note that 90% of all organizations surveyed in this particular round of survey data and in our prior round have experienced declines in revenue, 90% of all organizations. In terms of bright lights, certain organizations have seen increases in types of revenue. You'll note that philanthropic revenue, 30% reported 20% or more increase in this area. And as you know, when disasters happen, we have generally a large public response and a large organized philanthropic response from foundations and corporate foundations and the like. And certainly this one is no different, and philanthropy generally is wonderful at stepping up and saving the day in terms of some organizations' acute needs for client service, related expenses, and retaining staff. 23% of our respondents saw a significant increase in individual revenues. So you can see between the philanthropic and individual revenue increases, some organizations, and this was particularly visible in the frontline workers, healthcare, health centers, food, security, human services types of organizations that were the beneficiaries of this response. And then we see a slight increase in government funding, and this is particularly relevant to federal funds that were allocated for specific relief of vulnerable populations. In terms of small organizations, if you're $250,000 or less, the majority of these organizations do get their money from individuals. It is, and then some from foundation giving. It is less likely that these organizations would get government funding or, large corporate grants and that kind of thing. So this is what they rely on. And 60% of these small organizations report significant impact of 20% or more in these funds, with 17% reporting more than a 50% decrease. And so we saw an outsized impact on these smaller organizations that typically work in neighborhoods and local areas and counties. In terms of nonprofits forecasting over the next 6 months, we can see that many nonprofits, if you look at the significant and very significant sort of columns here, project an across the board impact on earned and particularly earned and then philanthropic revenue. A little less on government, but again, this survey was done prior to the governmental cuts. And so we have a somewhat negative view of our revenue forecasting. We'll talk about this a little bit later. In terms of overall financial stability for organizations that are 500,000 and up, so we're talking about mid-size and then large and super large, 30% are estimating less than 6 months of viability. So that means that all things being equal, if the experience and their revenue doesn't change, they would have about 6 months of viability in terms of their ability to operate. And then 26% are estimating less than 12 months. So the large organizations, a little bit more stable, as you'll see, than smaller organizations, 250 or less, who have less financial viability. 26% estimate that they have 4 months or less of operating capital, all things being equal and staying the same, and then 23% less than 6 months. So there are a much more fragile group as a whole. How are agencies managing these revenue drops? 45% are using reserves, but thankfully, as of yet, not fully tapping those reserves. So you're talking about, anywhere from 5 to 15% usage of those reserves, and then 10% lines of credit and 10% endowment funds. It's also important to note that most organizations don't have endowments. That's really some mid-size and many large organizations do have endowment funds, but the majority of nonprofits do not have those, nor do the majority of nonprofits have lines of credit. And so of those that do, 10% are using them. It's also important to note that among mid-sized organizations in particular, 15% report never having reserves, as in they have no reserves now, never had them. And 50% no line of credit, 58% no endowment funds. When we talk about 250,000 or under, this becomes a much larger number. About 40% do not have reserves. And then the vast majority, no lines of credit, no endowment, as we talked about. Thankfully, PPP came through for the nonprofit sector, and at least those that responded. 94% of organizations 500 and up got a PPP or an EIDL loan, and 86% of those under $250,000 in revenue were approved for a PPP loan. In general, as we look at projections over the next 6 months, nonprofits are projecting to reduce their scope, as in maybe cutting out a program or one or more programs that they're not able to support anymore, and or reducing their location coverage. So they might have been, for example, covering, a 5-county area, and they may need to reduce that to a 3-county area. And that's some of the ways that nonprofits are now coping with the loss of revenue and the projected continuation of that. In terms of service delivery, this is a conundrum because while they're projecting some scope reduction, 67% of our agencies are experiencing a 20% or more increase in demand for one or more of their services, and 41%, the majority, are experiencing a 50% or more demand. And they have shifted their work to COVID-19 services. So 68% have adapted and just sort of completely shifted one or more programs into COVID-19. So an example of that would be maybe a mental health agency that had a lot of personal interaction with a particular community might now be doing food delivery services, and just completely changed some of the things that they're doing to respond. Some organizations, arts, culture, museums, historic sites, even some agencies that were mandated as non-essential and had to close or to close for safety reasons, saw service decreases. So 54% were experiencing a 20% or more or lower demand. And of these, 41% were experiencing a 50% or lower demand in one or more service areas. It's, as you might imagine, COVID has radically disrupted services. As I said, about 68% of respondents added COVID-specific services. 60% have redeployed staff into COVID-specific services. So that's a good thing. 83% have stopped some component of regular services that they had. That is a lot. So you have to remember that many nonprofits have more than one kind of program type. So while they may be continuing one thing, they may be stopping other things. But certainly for arts, culture, museums, historic sites, even some health clinics that had to close, 83% have stopped regular services. And then 77% are delivering services via virtual mechanisms. So that pivot to virtual and cloud-based and Zoom related or Zoom delivered services has certainly happened in the nonprofit sector. So again, 77% are delivering virtual, and this is in terms of how services will change over time. 50%, again, plan to reduce their service scope or locations, and so we're doing more virtually. We're looking at ways to mitigate income loss in terms of reductions, but we're also restructuring our services and how they are delivered, particularly over the next 6 months when many agencies are unsure about their capability to reopen fully or reopen at all. And then among agencies that are recalibrating or restructuring their service delivery models, about 38% are likely to make these permanent, and then 30% are somewhat likely. So we're going to have, I think, a change in the way services are delivered, models for service delivery, probably a lot of blended models is our guess of cutting down maybe some of the in-person, doing more virtually, but time will tell. In terms of difficulty serving clients during this pandemic, sort of phased trajectory of this pandemic of, acceleration and then kind of transition and deceleration and recovery, nonprofits are reporting that, if you're a direct service provider, it's very hard, sometimes impossible, to deliver the type of quality and effective services that are needed when you are doing virtual provisioning. So a lot of times clients are served face-to-face in counseling models, or they are in peer groups. Substance abuse often has peer groups or individual counseling, individual planning. Certainly if you have very vulnerable populations, you have staff moving out into the field and checking on people, checking on elderly people. And oftentimes in rural areas, the ability and capability to have internet connection to access virtual services is almost none. And certainly if you are homeless or you're elderly and not adept at using technology, it is very, very difficult to serve. And so this was a huge component of feedback that, you know, our services are often very human service delivered. And if you're an arts organization, they're very experiential, and you lose something over the virtual delivery of a play or a performance. And so many people are grappling with that. Second, shortages are a problem and continue to be, especially food, and that includes food for humans, but also food for pets. Volunteers, you know, much of the sector really relies on volunteers to do what otherwise would be done by staff. And these are critical jobs, you know, literally feeding animals or delivering food to seniors, those types of things. So volunteer shortages have been an acute problem for nonprofits, and certainly funding for emergency assistance like rent assistance and the utility assistance, for example, is a big problem. I will note that also shortages of personal protective equipment such as masks and gloves are also a very large problem among nonprofit providers, not just healthcare providers. As I said, clients often have a hard time accessing services, even if nonprofits are able to deliver them. And that is driven by low technology and then certainly transportation. If, you know, for example, students are generally getting their food at school, you know, with school lunch, and suddenly that resource is turned off and their parents have to then drive to the school to get their food, or drive to dispersed food pantries to get food, and they don't have transportation. This is an issue. Nonprofits also have those with increased demand. Right now have lower staffing as COVID-19 hit and revenues dropped. Many nonprofits furloughed staff or laid staff off, and as demand continues to rise, as these economic conditions deepen for many of our neighbors and communities, we just simply don't have adequate staff. And I mentioned the fact that many nonprofits, and particularly as they get smaller, heavily rely on volunteers. And without those, they don't have volunteer staff to deliver the services. And then I want to talk about the fact that there is mounting client stress. You know, initially it was unemployment and food insecurity, and we saw the effect of that with these long lines all over the state of Georgia with food insecure individuals and that type of thing. But I have to say that as the economic conditions worsen for some of our neighbors and communities, and we have had evictions and utility disconnects will be a problem. We've had courts closed, so we haven't been processing evictions. There's been a moratorium on evictions in many cities, as there has been for utility disconnects. And so as these multiple months of non-payment mount, it's becoming a more expensive and a more intractable problem than we've seen. Job reentry is a mounting issue as people's unemployment runs out and the $600 payments from the federal government cease to happen. And so people will be more financially insecure, and job retraining, job placement and finding will become a huge issue over the coming months. As will mental health services. And then I might add, since we have the recent state cuts to mental health and disabilities services and housing for disabled adults, this will become a rising need as well. In addition, state cuts were also affecting TANF, which is financial assistance for low-income individuals across the state. And so we have kind of a conglomeration of factors here that are going to affect financially insecure, and vulnerable populations across the state of Georgia that nonprofits will have to respond to. And then finally, audience and participants do not feel safe enough to return to agencies. And I might add that safety is the #1 concern in terms of reopening for nonprofit organizations, and certainly their concern for their clients and patrons as they try to get them back into normal service mode. In terms of workforce, we talked a little bit about this, but 50% of nonprofits anticipate workforce reductions over the next 3 months, and those include layoffs, furloughs, and reduced hours. And thankfully, we did ask, you know, the extent to which these would occur, and they are minimum to moderate at this time in terms of the projection over the next 3 months. So time will tell what this looks like over the longer term. In terms of coming back to work and reopening facilities, staff safety and client safety, as I said, are the most paramount concerns. And then limited childcare for staff and volunteers is another barrier to reopening. Sometimes organizations have laid off staff, and their ability to rehire and find them, this is particularly true of childcare centers, is a continuous problem right now. 42% of agencies plan to reopen by July, and another 34% in the next 4 to 6 months, given the situation as it is currently. In terms of nonprofits forecasting their confidence moving forward and their feeling about what might happen, we looked at fundraising, and as you can see, 34% of our organizations expect lower foundation revenue. So about a third of us expect lower foundation revenue. Over half of us do expect impacts to corporate revenue. And, you know, we've watched as corporations have struggled with this pandemic, some more than others, and certainly have had their own layoffs and things happen. And so we understand that to you know, be a projected effect on corporate giving. And then 48% also anticipate lower individual giving. And this is forecasting into 2021. So we're talking about end of the year giving here in particular. Nonprofits need money moving forward for these areas. Some have dipped into reserves and are really needing to resource increased demand as it's rising. As you might imagine, you know, providing ever more food, ever more eviction services, ever more mental health services to an increasing population in need of that. You need revenue to cover it. So 69% need revenue just to cover what's going on now. General operating revenue to cover lost revenues, and this includes like arts organizations that have lost their revenues and have immediate needs to pay staff and keep facilities running, and you know, all of their staff on board, that kind of thing. They need 53% need general operating to cover that kind of revenue. Operating revenue projected over the next 6 to 9 months, 68% are in dire need of that. And then we looked at the need to purchase large quantities of supplies. And so we had agencies, for example, senior food services, that needed to ramp up quickly to relieve waiting lists of seniors that were suddenly in need. And that requires the purchase of food, large quantities of food, in order to make that happen. And that seems to have tamped down a little bit, but 17% do need resources to purchase large quantities of, for example, PPE to reopen for their volunteers and staff, or cleaning supplies to keep their homeless facilities safe, or food in order to continue to serve rising and mounting needs, for example. In-kind donations remain an issue. 25% of large agencies need things such as food or cleaning supplies, PPE, technology, that kind of thing. 30% for smaller organizations. So the need is higher there in smaller organizations across the state. And by the way, there are more smaller organizations than large organizations across the state. 85% of all nonprofit organizations are under $500,000. Top needs other than money: help with fundraising strategy, mental health and stress reduction for staff, help adapting programs and retooling strategy. These are the top needs other than just sheer dollars. Staffing and volunteer shortages. Technology for workforce and for clients remains a big issue. And as we noted, access for clients, the number one access issue right now during COVID-19 is access to technology, either to have a computer with a video component to it, and or internet access. In terms of confidence moving forward over the next 12 months, what we love about nonprofits is they are absolutely optimistic and always there to serve. And so 84% are confident they can weather this situation, even though it might be difficult. But when they look at their peers, only 35% are confident that their peers can weather the situation. And so while they're thinking of their own situation and saying, yes, we can do this, they're very worried about their peer sets in whatever subsector they're in. At the same time, this confidence is somewhat undermined by the fact that only 26% of nonprofits surveyed express a positive outlook for the nonprofit sector in Georgia currently. And only 19% have a positive fundraising outlook over the next 3 months, and 23% over the next 12 months. So we don't have a very positive outlook for the sector or a positive fundraising outlook. But we are confident that we will continue to serve, is what it sounds like. And then I think a lot of this is also driven by the fact that 57% anticipate a negative end of the year giving trend coming up. So we will see how that plays out over the next 6 months as we move into December. Driving low confidence, nonprofits believe in their heart that the public supports them. They have high confidence that the public supports nonprofits, but they're not actually confident that the actual giving capacity over the next 12 months will meet what people have in their hearts, because a lot of people are unemployed and have had their compensation lowered by their companies, or they're just unsure about what the future holds. Nonprofits need to stabilize service delivery plans. You can imagine they're trying to figure out, are we going to reopen in the next 6 months or not? Are we going to continue to deliver remote services to clients or not? Can our clients access those services if they are delivered remote? What is the cost to adapt our services? Do we have the staff skills to do that? There's a lot of questions. And so nonprofits are working through those now. Staffing patterns are also an issue. If their nonprofit leaders are asking themselves, if I staff back up and the economy, dips again, or we have much lower end of the year giving, am I going to have to just turn around and let people go? How do we adapt our policies to go fully remote for staff, and do they have the capability to do that? Some do, some don't. What are the technology costs to go fully or more remote than they are now in terms of their delivery of services or work? And so workforce planning is a key issue. Nonprofits lack confidence that they can safely open. This includes concerns about liability for their staff, their volunteers, but also their clients and patrons coming in. And frankly, it's still very difficult to get personal protective equipment. It's a big issue, and there are constant shortages of it. So they're not confident that they can safely open at the current time. Nonprofits are worried about the ability to support their client needs, to provide transportation or money for transportation, to have enough financial assistance to help people with their mounting rent and utility and, just financial fragility issues. They're unsure whether we're going to have continued demand spikes, more layoffs, for example, as this economic fallout continues, and as these funds and competence and funding streams decline or impacted, they are very concerned about service delivery and client needs. And then nonprofits do need to retool, they do need to adapt. All of these things sort of indicate that, but they have very low bandwidth to do it. We mentioned they have less staff, less volunteers, less time as they're in crisis mode, and they lack clarity about how to respond for all of the reasons that I've just mentioned. And then we have a lot of exhaustion and stress, particularly on frontline workers. But frankly, even among arts organizations and culture museums, it's just as if it is in the for-profit sector when you're worried about keeping your employees employed and your facilities cared for and your mission and business. There's a lot of stress on leaders at this point, and certainly front lines that have been bearing the brunt of human need during this time are completely overtaxed and stressed. What would help? The ability to know more readily what institutional funders, organized philanthropy, are planning for the end of the year and across 2021. And this includes corporate donors in particular. So that transparent communication about plans and amounts and what they're going to be focused on is very important. A way to galvanize end of the year giving together, perhaps cohesive public messaging and a coordinated campaign for that. I know Georgia Gives Day is and Giving Tuesday is coming up, but that end of the year campaign focus and really bringing the public's attention to the needs and community and the needs of nonprofits is a huge concern and focus right now of nonprofits. A way to increase the technology of clients and also their ability to connect to the internet. And this goes for their remote staff as well. What in rural areas, what affects their clients affects their staff. If you don't have internet access, it's hard to work and serve clients. Liability relief and reliable PPE access is a big deal, and planning assistance that does heavy lifting for staff. So, analysis, data-driven decision-making, that type of thing, so that they can gain clarity in terms of adapted strategies that they can believe in and count on moving forward would help greatly. Just a quick note on the nonprofit experience with organized philanthropy and the funder response. In all, we applaud funders. They're doing a good job at communicating. They're offering flexible funding and increasing their support. Some are increasing their support. And so we applaud that and encourage our donor community to continue, considering paying out more than what the required amounts are in terms of IRS requirements or their general practices. Offering increased flexibility and more operating as we've long requested, and continuing that good communication with individual grantees and frankly groups of grantees, because we learn a lot about what different proposals are coming into foundations and what that means in terms of trends and needs in the sector. If you're $250,000 in revenue and up, you're seeing philanthropy as supportive and responsive and helpful and flexible and that type of thing, which indicates that this group of organizations are indeed receiving philanthropic support. But as you can see, and as I talked about earlier in this presentation, if you're less than $250,000, you're seeing organized philanthropy as absent, or you are indicating that you get no organized philanthropic dollars, i.e. foundation dollars, corporate foundation dollars. So we can see that small neighborhood, locally focused groups in particular are not all that supported by organized philanthropy. And so as we are contemplating equity issues, social justice issues, and that type of thing that are typically supported by smaller agencies, and as we are contemplating how to get services layered into small communities, which are often underserved or not served by very large nonprofits, support for these smaller organizations is critical. So funders can be very helpful by, again, providing unrestricted or general operating funds, funds for staffing, which is not a favorite of many in organized philanthropy. Most like to fund programs and capital campaigns for buildings and that type of thing, but nonprofits really need to retain their staff right now. Loosening reporting requirements and just overall requirements like audits, for example, that are highly expensive for smaller organizations and are barriers to funding. Increasing payouts and funding specific needs like technology supplies, and then advocacy as well as just direct client needs. So that in its is the results of the survey. We hope you found this enlightening and helpful, particularly as you work with your boards to help them understand what's going on in community and how that's impacting your ability to serve and your community's ability to serve. As always, the Georgia Center for Nonprofits is here for you. We offer a variety of different resources and training and consulting services for organizations. We have an entire COVID resource center and many, many resources that are freely available for all kinds of nonprofits across the state. So go to gcn.org and you'll be able to access an enormous array of freely available resources to help you navigate these situations. And then feel free to always reach out to the Georgia Center for Nonprofits for any assistance that you might need. Thank you very much.